next speaker, Dr. Rabia Nas, talking about the VVT IOL. Welcome, please.
Thank you. Um, Good afternoon, everyone. Today I'll be presenting on the visual outcomes, quality of life, patient satisfaction after extended depth of focus IOL implant. I have no conflict of interest. Why should one prefer an extended depth of focus IOL? It is to gain an uninterrupted vision across all distances, to minimize the dependency on corrective eyewear, to minimize visual disturbances like glares and halos in low light conditions, and to gain a good night vision with unaffected contrast sensitivity. The advancement in the extended depth of focus IOL is that it stretches the light wavefront, giving a seamless vision across a continuous extended focal range which covers distance, intermediate, and near vision. The aim of my study is to study the visual outcomes, quality of life, and patient satisfaction after extended depth of focus IOL implantation. I had included all the patients above 18 years of age who had presented with clinically significant cataract, patients who had ocular comorbidities like pre-existing glaucoma, retinal diseases, corneal opacity or amblyopia which could hamper the post-operative outcome were excluded. It was a single-center prospective interventional study conducted at National Institute of Ophthalmology, Pune between January 2022 to March 2024 on 340 eyes of 170 patients after a detailed comprehensive evaluation. The mean age of patients was around 61.6 years and the gender distribution showed 61% male and 38% females. The outcome was assessed as binocular uncorrected visual acuity across distance, intermediate and near, which revealed that nearly all the eyes showed 100% vision, that is 6/9 vision across distance and intermediate, and for near uncorrected visual acuity was 48.8% achieving N6 vision, 38% had achieved N8, 12.4% had achieved N10, and 0.6% had achieved N12 vision. The quality of life was indicated by giving a questionnaire to the patients 1 month post extended depth of focus IOL implant bilaterally. It was to judge their quality of life in day-to-day activities. So for the intermediate and distance work, 100% patients did not have little or no difficulty in doing activities like seeing traffic lights, seeing steps while walking, watching television, etc. While some patients, like 96% patients had difficulty while working on computers, and 92% patients had difficulty in riding two-wheeler or driving four-wheeler. Similarly, for the near vision, 100% patients had little or no difficulty in reading large fonts, writing checks or forms, texting on phone, whereas for small prints and reading newspapers, 88% patients had little or no difficulty. The patient satisfaction scores were particularly for seeing the glares and halos complications post extended depth of focus IOL implantation. It showed that 100% patient had little or no difficulty complaining of any halos around bright light. 98% had little or no difficulty for glares of oncoming, for complaining of glares with the oncoming headlights, and 99% had no such difficulty of complaints like seeing shadows around objects. So in the end, I would like to conclude that after extended depth of focus IOL implantation, nearly all the patients had achieved an uncorrected distance and intermediate visual acuity of 6/9, with 87% patients achieving N8 or better vision for near. And with the quality of life, majority of the patients had little or no difficulty in day-to-day activities, and they all had a very high satisfaction score. The extended depth of focus IOL implant actually addresses the limitations of the traditional monofocal lens, as well as covers some of the drawbacks of the current multifocal lens, seeking functional vision across multiple distances with very less visual disturbances. Thank you.
Are there any questions?
This VVT claims to be the true EDOF, only true EDOF. Have you compared it with any other EDOF in the market?
No, ma'am, as such, no.
So, when you say true EDOF, there's like an ANSI standard where there are several lenses that were classified. So if the company chooses to submit, they will be rated. Now, there are many companies who also have the EDOF but don't choose to submit. So it's hard now to tell. Yeah. So, but then it's based on doctors' experience, what they like to use in their, and country to country availability.
When you choose EDOF IOLs, is there any significance for the angle alpha and angle kappa?
Yes, ma'am, we do take that into account that while doing the biometry, the IX and IY score should not be more than 0.6. Although this is much more important in taking a multifocal intraocular lens, but in extended depth of focus IOL also, we had taken patients who had as such no comorbidities, and also their biometry did not show any increase in alpha angle.
So angle alpha, angle kappa, usually you take that into account when choosing presbyopia correcting lenses. So not only EDOF, multifocal. So I think whatever standard you use for your multifocal will be a similar standard for your EDOF. That way you don't get into trouble and you don't risk, right? You think that, oh, this is risky, I use EDOF versus multifocal. No. If this is risky, just go to monofocal. That's it. Okay, thank you. Yes, yes. People size? Any comment? Any? Yeah. Okay, thank you.